Good day! In this video, I'm going to show you on how to assess vital signs on an infant. But first, make sure to sanitize all the equipment needed and perform hand hygiene.
Assess for any signs of distress, nasal flaring, chest restrictions, and skin color. Count for 1 full minute. At this age, the rate is irregular, so you need to count for 1 full minute. Infants have what is called periodic breathing. Watch the rise and fall of the chest. 1 rise and 1 fall equals 1 breath.
No nostril flaring present. No chest restriction present. The skin color is appropriate to the skin tone of the baby. There is no sign of cyanosis. Her respiration is 45 breaths per minute.
Count the apical pulse by auscultating for 1 full minute. The apical pulse on an infant is found at the 4th intercostal space, lateral to the midclavicular line. The heart rate is going to be fast, so it will take you practice when learning how to count the heart rate on an infant.
Her heart rate is 125 beats per minute.
Place the tip of the thermometer within the fold of the armpit, then close the arm and wait for the thermometer to beep.
The temperature of the infant is 36.7.
Nurses can measure an infant blood pressure with non-invasive tools, such as blood pressure cuffs. These monitors will present blood pressure readings using 2 distinct measures, the systolic reading and the diastolic reading. Infants may have abnormal blood pressure just as adults do, and readings that fall consistently outside the healthy range can suggest a high risk of the patient developing significant heart or kidney problem as they get older.
Blood pressure of the infant is 72/37.
Place infant on the scale and obtain weight.
The weight of the infant is 9 pounds and 4 ounces.
Measure from head to heel and place paper behind infant to mark length areas. Lay baby back. Keep head midline and extend a leg. Mark these areas on the paper and measure with measuring tape.
The length of the infant is 19 inches.
Use a measuring tape and measure in centimeters. Measure in the largest diameter of the head. This is found around the forehead and the prominent part of the back of the head.
Head circumference of the infant is 35 centimeters.
Use a measuring tape and measure in centimeters. Wrap the measuring tape around the infant's chest and use the nipple line as a guide.